Hello and welcome everyone to the October module. We are focusing this month on Coordinated Care Organization, or CCO, changes. And so we'll be talking about that today. So we're going to do a couple things today. We're going to start by talking about when an OHP member can change CCOs and briefly touch on the different enrollment timelines that people may experience. And then the main focus today is to talk about how you as a community partner can help someone understand how to change their CCOs, help them change their CCOs, and understand what's going to happen and the timeline and the best way to make that happen as timely as possible. So there are sort of a few different things we're going to focus on. We think one of the most common things that we can help you with is if someone is changing address to a place where they need a new CCO, how to make sure that goes smoothly. There's also that situation where someone maybe has multiple CCOs in their area, and it's not that they're moving, but they do want to change CCOs. And then sort of across those two different scenarios, whether someone does or doesn't have urgent medical needs can change how we're going to go about helping them. Just realized I don't think I said on the recording, hello, my name is Jessica Diaz and I'll be your main presenter today. So I'll do that now. Thank you all so much. Let's talk a little bit about coordinated care organizations just to set an overview. There are 15 CCOs in Oregon, and about 90% of OHP members are enrolled in a CCO. Those CCOs are then responsible for coordinating the care of their members. So a coordinated care organization is a network of all types of healthcare providers, not only physical health, but also addictions and mental health care, dental health care providers, there's vision providers. Everyone works together in their local communities to serve people who receive healthcare coverage under OHP, the Oregon Health Plan, aka Medicaid. And CCOs really focus on prevention and helping people manage chronic conditions like diabetes in order to reduce unnecessary emergency room visits and give people the support to be healthy, not just to get help when they're sick. Quick caveat that there is care coordination for people who don't have CCOs as well. You may have heard us talk about KeyPro in the past, and KeyPro is a group of folks who help people with their open card or fee-for-service care coordination if people are not on a CCO and need that. And they have a website. They're reachable at 1-800-562-4620. And then final caveat on the caveat is that tribal members also have an additional care coordination team at Care Oregon. So we're not going to focus a lot on that today, but we did want to call it out so that you can point people in the right direction if someone does not on a CCO, is not transitioning onto a CCO. And then we're going to talk mostly about CCOs today. So I already went over objectives, but we thought we'd put our biggest takeaway, if there's one thing, well, I guess two things, because we have 2 bullet points here, that you are remembering about the presentation today. It is that if someone needs their address changed, the best way for a community partner to help them with that is to talk directly to the One Customer Service Center, either through that CP line, which is 888-865-0525, or by emailing the One Customer Service Center at oregon.benefits@dhsoha.state.or.us. So that's if an address change needs to happen. It's a different team of people who can help expedite and sort of are the experts on CCO changes, and that's the Client Services Unit, also known as CSU. They have a different phone number, which is 1-800-273-0557. So this screen right here, great cheat sheet for helping someone who moves and or needs a new CCO. This is the best way to do those two pieces, address change and CCO change. And my notes say the rest is gravy. So we're going to go into some somewhat complicated concepts, but the main thing to know, it's all on this slide right here. So let's talk a little bit about when an OHP member can change their CCO. So there are times when people can change CCOs and there are times when people must change CCOs. This first bullet point is when someone has to change a CCO because they are permanently moving into an area or region that their current CCO does not serve. So CCOs are those local entities, and if you move, for instance, from Medford to Portland, you're going to have a different CCO landscape in those two locations. Another time that someone can request a CCO change is if they have more than one CCOs in their area. And in fact, I'm going to quickly take us back to this map because you can see everywhere where there is these diagonal lines, that denotes that there is more than one CCO in that area. So you see the Portland metro area, Lane County, and some of Douglas County, and then in Southern Oregon, there are places where people can have a choice between CCOs without moving. I'll bring us back here. There are some limitations written into the rules about how often and when people can change CCOs if they're not moving. We're going to touch on it briefly. If you want to learn more, goodness, there's some Oregon administrative rules I can show you, and we can do that at some other time. But we do want you to know that there might be times when someone requests a CCO change and it's not a time when they're allowed to do so. For instance, if they just did a CCO change, you can't sort of flip back and forth. There are some limitations. If you are a tribal member, however, you can change CCOs or disenroll from a CCO to open card once a month, and you could do that every single month if you so choose. It is important to note that a CCO can't help anyone until they are fully enrolled in that CCO. So until a CCO knows who their clients are, they are really limited in what they can do directly to help that person, and we can play a really important role in making sure that happens smoothly. I mentioned in the last slide that someone must permanently move in order to change CCOs. There are times when people may temporarily move, and that is a little different from a permanent move. So if someone is temporarily away from their primary residence or service area, they should stay in their same CCO. Their home CCO remains responsible for their care even when they are away. So the CCO has responsibilities even if someone is not actively in their catchment area at the moment. And this includes people who are temporarily away for treatment. So residential treatment, mental health or substance use disorder are some examples we see fairly often. Let's say they're away for college temporarily, the military, or to do seasonal work. If that is not a permanent move, then it should not be put on the application as a physical or permanent address. You could put it as a mailing address if people want to get their mail somewhere else, but just make sure that you do not change the physical or permanent address when someone has a temporary move. So now that we've touched on when and how people, well, not the how, just the when, we're getting to the how, sorry, someone can change CCOs. Let's talk more about your role as a community partner and what you can do to help someone make a CCO change request. And part of that involves those timelines. So the timeline for CCO enrollment depends on the member's situation and how that change was requested. Address changes that are requested through the applicant portal can cause delays of over a month, and that relates to how the one system rules work when doing an eligibility update. Now, the One System worker portal has some tools that aren't in the applicant portal. So if you work directly with ODHS staff to enter the address change as a non-eligibility update, then that means a new CCO can start within 1 to 2 weeks instead of a month or longer. So there's a pretty big difference in experience that someone may have if they talk to a human or email a human directly versus using the applicant portal. This is one shortcoming of applicant portal that we want to be really honest about. And that process I just talked about, that's 1 to 2 weeks. That is business as usual. There are even faster processes that can potentially be used if there is medical urgency on a case, and if someone has an access to care need that it's going to harm them if they do not get into that new CCO, get care faster than the timelines we're laying out on this slide. So you're going to hear us refer to client services unit, and you'll see this same phone number a few times. That's because they are the team to help with expedited enrollment requests, and we're going to talk more about when that's appropriate and how to do it. I do want to point out that CSU cannot process address changes directly, so that's why we have to start with ODHS staff if there's an address change, and then we can follow it up with client services unit. So let's talk about that situation where someone has a permanent address change. It is to a new CCO region, and they want to make sure that they request that CCO change. The first thing you do as a CP is to report the address change. It's really important to do the address change first because everything else is going to hinge on that address being correct in our systems. So, and this is a little repetitive, but that's because it is our big thing we want you to take away today, is first call the CP line. That's the One Customer Service Center at 888-865-0525. Or if it's not urgent, you may want to email that address change, and you can do that via secure email to Oregon.benefits. Now, the staff should know how to do this, but it can be helpful to specify that the address change should be updated as a non-eligibility update. And if there are any other changes that also need to happen, it's important that the address change happens first. So staff should be trained to do this, but this is a handy thing you can mention just to make sure it happens the right way and there aren't any delays. If someone is moving to a region that has more than one CCO, this is a great time to also provide a preferred CCO. Otherwise, people might get auto-enrolled in one, kind of a roll of the die situation. So with an address change, if there's more than one CCO in the region and someone knows which CCO they want, they should also provide the CCO, the preferred CCO, at the same time as the address change. And as I said a second ago, it's completely fine if people have other changes they need to do too, but it is important if we want the CCO to flip in a timely manner that we report the address change first, and then we can follow up with any of those other changes like income, maybe someone joined or left the household, things like that. And you can do that in the applicant portal. Anything that's an eligibility change can be done in the applicant portal just fine. It's if it's this special non-eligibility update, which is pretty much going to be address changes for our purposes, it can happen faster if we talk to a human. So let's talk about if someone is not moving, but they have more than one CCO in their region and they want to make a switch. If someone just wants to change CCOs and make no other changes, that's a great time to call the client services unit. Any community partner who is associated with the case can call client services unit on the client's behalf to help make these changes. Requesting a CCO change via applicant portal, just like the address change, does lead to delays in enrollment due to just the system logic of how it can only do eligibility updates. CCO changes are not guaranteed. CSU will review every single request, and they will follow a whole bunch of complicated enrollment rules and guidelines that they have at their disposal, and they should explain it to you as they walk through what they can or cannot do. So sometimes people may not be eligible to change their CCOs, or they'll have to wait a little bit, but CSU should walk you through any of that, anything that's complicated in that direction. Now, if there are other changes that do need to be reported in addition to the CCO change, just like that last example, prioritize the CCO change first and then report the other changes. You can do those other changes in applicant portal, or you can use the CP line or the Oregon.benefits email to report those other changes. Now, those were the business as usual best practices. Let's talk about urgent CCO change requests next. Now, the client services unit has defined levels of urgency that they're supposed to screen the different situations for. And they may designate that particular case or situation as medium, higher priority need, or urgent. Medium is no immediate need and the usual enrollment cycles, the system working as it was designed to, is going to work for the member situation, so they're not going to take special action. I want to point out that needing to bill for a service that has already happened is not considered urgent. It may feel urgent to you, or to the client because maybe they saw something weird happen with the billing and they're very concerned about it. But a provider should be able to rebill and work things out after the fact, and that is not considered a client services unit urgent situation. There may be different rules and different criteria for if you're working with provider services, but I just want to repeat, for client services unit, billing needs for something that's already happened is not considered an access to care issue. It would only be for future or immediately needed things happening today, tomorrow, something like that. Higher priority need is it could wait a few days, but we do need to expedite it and take special action beyond the weekly or monthly cycles. And so that's sort of the middle ground between medium and urgent. And you may be told that the case is a priority need or a high need, and that CSU will work it in the next couple days. Now, urgent, when it comes to CSU, means that someone needs something today, tomorrow morning. There is someone whose health and well-being is going to be dramatically affected by not being able to see a provider, by not being able to get a prescription, something like that, right away. So there's a very specific urgent criteria level for client services unit that might be a little different than what you've experienced with the one customer service center, for example. Now let's talk a little bit more about urgent requests and give it a little more context. Here are some examples of things that are often considered urgent. See, if someone has a pre-op or post-op or surgery appointment that is scheduled and is in the very near future. If someone needs to do a same day or early morning appointment for a critical service. Pharmacy issues, dental pain, infection, and swelling. These are the types of things where we're going to need to give client service unit, my bad, these acronyms. The client services unit needs enough information to be able to tell if it's an urgent or priority or medium request. And it is not guaranteed. It is reviewed on a case-by-case basis. So now we've laid that groundwork for what is an urgent request. How do you as a community partner make an urgent request? So we have one direct line to do this, and that is the client services unit. And we have a handy kind of a template. It's It's essentially the kind of information that CSU needs in order to make that correct determination of medium, high, or urgent. And if anything on this list is not given to CSU, they're going to default to not urgent. So it is really important to gather all of this information in advance of calling. We're going to need your name and ID so that we can make sure you're associated to the case. We need the member's name and prime number. We need specific details about why this need is urgent. So what are the medications needed? What is the treatment needed? Are there appointments scheduled, and what are they for? Some of these are a little more aimed at provider organizations. So there are some where, like this next one, is there a prior authorization approved and in place? If you don't have knowledge about a prior authorization, you can default to no on this. If someone does have, a specific prescription or a specific appointment coming up, we need that doctor's information. We need that facility or pharmacy. We need a way to contact them. So details on the appointments, where the appointment is, what type of appointment it is, who the doctor is, how to reach them, all of this information is very important. Does this provider take fee for service? One of the things that I keep saying customer instead of client. I am so sorry, you all. Client services unit is able sometimes to move people more quickly into OpenCard and move them into OpenCard in between CCO enrollments. And if that's going to solve that person's immediate need, they know that they can stop there and not move along to expediting the next CCO enrollment. So they can pause someone in that fee for service so they can get what they need right away and then move them into that other CCO. So what actions they're going to take, working directly with the CCO and escalating through multiple teams and some pretty complicated pathways. They want to do what's going to work best for the client. So they're only going to take that extra CCO, like intensive expediting, if it is really needed. And then, of course, it's important to know which CCO or DCO is being requested. And then CSU will make one callback attempt to clarify information if they don't have enough or they don't understand the information they have. So that can be either the client directly or you as the community partner if you feel like you have access to that information. And you can leave a callback number. And then this is a question, but really the answer is someone needs to have tried working with their CCO first. And some indication that the member has attempted to resolve their access needs with their current CCO before trying this path, because the CCO is ultimately, their current CCO, no matter who that is ultimately the one responsible for their care until they are no longer on that CCO. So it is important that that happens as well. And this is all the information that CSU needs to make that case for an urgent request. It may or may not be granted based on the information that CSU finds. CSU might then do more digging and contact the provider directly, something like that. But they will do their due diligence. And something that I've heard and do really want to stress is that CSU isn't looking for reasons to deny an urgent request. They're looking for reasons to give it. So the better we can get enough information so that they can make that decision and make it well, it's going to serve everyone better. And I know that this was a lot of information given to you pretty quickly. So I'm actually, let's see here. I want to skip us back to the takeaways and just keep us here for a second. Because this is really the information that we want you to know. I would say if there was a number 3, it would be there is a pathway for urgent requests and it has some very specific information that you need to give for it to be granted. But because I got so weedy so fast, I wanted to take a moment to breathe on this slide again and maybe start collecting questions for us so that we can answer any questions you may have about CCO changes and about the ways in which it works or doesn't work, in a timely fashion and how you all are experiencing it right now. And if you have any advice on what's been working for you, I'd also love to hear that. I'm going to pause for a second. Yeah.
So I'm looking at our questions. I don't have any specific ones just yet coming in, but thoughts on, there was a question, can we talk more about pharmacy issues? I just wanted to know if maybe there was a specific approach that they wanted us to cover in terms of pharmacy issues, but we could also wait till the end if you're comfortable with that, or I can wait to see if there's any other questions coming in. But we do have a CCO question first here. Any idea how a CCO change might impact a person needing to discharge from a hospital to a different county for long-term care?
Oh boy, what a good question. I don't want to not fully answer the question. And I know that when it comes to people who are inpatient care, are in inpatient care, there are some additional rules and protections to help that continuity of care. So I think that might be a good, I don't know if this is a 101, a good like graduate
Mhm.
course level. Um, and I would love to get subject matter experts to talk about the details of specific to hospital discharge, to residential treatment, to things like that, because that's a different situation entirely again. And I want to spend time and energy on it and do it right. I hope that's okay that I don't have an answer for you today.
All right, the next one here. So this one's just a comment. I've had very good luck with urgent CCO changes. It definitely helps having all your information in advance. Wonderful. Let's see. If CCO change is approved, will clients get a new ID card?
Ah, that's a good question. I believe as soon as someone gets onto a new CCO's roster, they are going to send out a welcome packet to that person. So yes, they would get information from their new CCO.
Perfect. Another question is, let's see here. Any idea why treatment facilities are not considered urgent? Mm,
Yeah, it's that same can of worms that
yeah.
I want to make sure we answer well. I think the one thing I can say for sure about that is a residential treatment facility by Oregon administrative rule is considered a temporary change. So it isn't that it's not urgent, it's that it's not a permanent move. And so it is the CCO, the home CCO's responsibility to continue meeting that person's needs. Um, and I think that needs to be its whole different module because there's a lot we could talk about there.
Mhm. Okay, the next one here. Let me see. Oh, I
We're
might have
getting a
lost.
lot of questions.
Yes, sorry. I'm trying to make sure I don't miss anything. How can a CP help a client with getting their current CCO to cover things in a different county? And I believe you might have mentioned that.
Oh, these are really good questions. I would say if you have a relationship with a CCO and you know folks at member services or otherwise who you might be able to help make that connection with, that can be a really good tool. It would be, I would love to learn more about how CCOs would explain this to their clients. That might be a good collaborative topic if we have CCO presence.
Mhm.
But I think
Okay.
it might vary a bit from CCO to CCO, so I'm not sure if there's a one size fits all solution. But it is the CCO's responsibility. A CP can help a client connect with that CCO, and we would love to search more and do more diligence, especially if you have specific situations or CCOs or examples where you'd like us to help from inside OHA too.
Let's see. There's another one here. Make sure I don't miss any here. Do you want me to also read off possible comments as well, Jessica, or just specific questions?
Let's focus on questions first.
Yep. All right, then let me go. Do the CCOs know they are responsible for members' care when they have moved until they are enrolled in a new CCO? We are often told no longer living in our service area, no coverage, or providers not contracted with our CCO due to out of service area.
Mm. I cannot answer on behalf of all CCOs, but I do
Mhm,
know that it is something that is written into the contracts. It has specifically written in, I think it strengthened in CCO 2.0, in fact, um, and that a CCO should be, if they don't have an ongoing contract with a provider, they should be able to set up, one-time agreements, and they should be meeting members' needs. And that might be a good time to involve our ombuds teams, our folks at provider services, and to make sure that we can improve situations where this isn't going smoothly.
mhm. Is it appropriate to ask for priority CCO enrollment when a client cannot get an appointment with their PCP because they are no longer taking the CCO they are currently enrolled in and have an urgent need?
That sounds like a very appropriate time to ask for that urgent CCO enrollment. The client services unit may need more details on what that urgent need is,
Mhm.
in order to make that determination, and they should be able to let you know why or why not it is considered urgent. I wish we had someone from CSU on the line, but I don't think we do.
I don't think so.
Also happy to bring your questions back to our client services unit as well. So if there are questions I can't answer, that's not the end of the line. We are collecting them, I promise. And I knew this would come up with today's topic because we're definitely learning alongside you all about the ins and the outs of some of these processes.
How soon can a client make a doctor's appointment after application has been approved?
I think that after an application has been approved, so someone is likely to stay on open card for that first week or two.
Mhm.
So if they are speaking with providers, or if you're helping someone set up an appointment with a provider, checking to see if that provider takes the CCO and or open card might be a great way to make sure that that goes smoothly. Um, I would say that clients can make appointments immediately. It's just a question of how the providers are set up to handle that open card or CCO enrolled person.
So if we update address, um, it won't automatically switch to a CCO in that area? Question.
Yeah, that's a good question. The answer is it will, but it will not do so quickly. So if you go into
Mhm.
applicant portal and put in a new address, you can even then click a new CCO throughout the application. But because of the way the one system makes sure it doesn't take adverse actions when changes are reported into the future when they're done through applicant portal. And now I know I'm getting weedy, but it will look into the future and not make those changes until the end of the month, sometimes the end of the next or the beginning of the next month. And so a change that has already happened will not show in MMIS until a month in the future. And that's what we're trying to avoid by talking directly to humans to do it manually instead of relying on the automated processes that for this one instance don't always serve people the best. And there is a change request in to try to see if we can make this work better in applicant portal. So we're sharing the current state of the system, and we do hope that it continues to get better. I don't know if that made sense. I hope it did.
Let's see, I think we have one more here that I can see. Would prenatal care be considered urgent?
I want to say yes. I'm not an expert on this, but I believe it will be. I know at the very least it is definitely higher priority. I'm not an expert on on the distinction between that for CSU, but it'll definitely be a higher priority than business as usual. That much I feel confident about.
Oh, I think we have another one that just came in. Is there a CCO form that we can fax or we have to call client services?
There is no form to fax. You must call client services in order to expedite a CCO change in any way.
And I think that was the last one.
I do want to call out, I see some things relating to people requesting open card, which is a topic that is related, but we didn't go over today. And there is a recording actually to a recent provider collaborative webinar where we talked at length about how to request open card and when that's appropriate and how it can be done. And that does involve having a provider who is helping a member walk through that, and also involves client services unit again. So we're not going to answer that today, but I just want you all to know that we do have some resources on that too.
I think we have a comment and a question, a comment within a question. So let's see. Sometimes I request a CCO change, expecting it to happen the next month, only to find out that the rep at client services did not complete the request correctly. The client has to wait another month, which does not seem fair. Is there a way of requesting a sooner change of CCO due to client services error? It's a good
My
question.
gosh, I absolutely want to see those cases and see what we can do to make that go more smoothly.
Mhm.
Susan, do you mind securely sending me if you have anything that like that that's active or anything happens in the future? I want to staff that myself to make sure that it gets fixed because that does not sound correct to me. And I will say then that your regional outreach coordinator is a great resource to expedite
Mhm.
things or to look into things internally if our different pathways that we're laying out for you today and in our other modules aren't working the way we are telling you they should. Because there are, gosh, it's easy to say, hey, this will happen, this is what's supposed to happen. But the reality of life is that things get a lot more complicated, people make mistakes, people end up in situations that are not ideal. And that is why, sort of like point one here, is talking to a human can sometimes resolve a lot of things that our automated systems can't. And talking to your rock and having them help you get to the bottom of a situation where something's gone sideways, that's what we're here for. So I do want to offer our services there as well.
And that is the last one, Jessica, for now.
All right, I'm going to quickly zip back to the end of the presentation, make sure I didn't leave anything out. But I don't think I did because now we're at questions. And
Okay.
thank you. I know technically this was a half-hour presentation, but we're happy to stick around for a little bit longer to see if there are any other questions that people have. I see people have put in comments about some people having really good interactions and having their problems solved, some people having it a little more complicated. Um, I know there were questions specific to pharmacy, and I would love to learn more about what you all are experiencing and see, as the provider coordinator for the Community Partner Outreach Program, feel free to send pharmacy concerns and questions my way. Um, we want to get to the bottom of anytime the situations are not going the way we have laid them out in our trainings. And then I also see a mention of the collaboratives, which is often a great place to talk directly to CCOs about what is and isn't working for clients and to learn from them as well as your rock. All right, it looks like our question box has calmed down. Let's see here.
Oh, I think we have some
Oh,
coming in now. Is there a way to report a provider's office that is refusing services due to the CCO? Mm,
I would say, you know what? Send that my way for now, and I have connections within the provider services unit, and we can investigate. And then, yeah, we didn't go into the details of the different timelines and the in-depth logic of, when something is 1 week, 2 weeks, when it's going to be 15 days, or it's going to be 1 month or 2 months. We have some materials on that if you really want to learn. Um, we wanted to stay away from that today because it got weedy really fast, but hit me up if you want to know more about those cycles. I can show you the OARs. It's really dense reading, but we do have some materials prepared where we're trying to parse that out. I was trying to learn it myself. So I see some interest in more details. We do have it. We're trying to figure out what's the right amount of information that's really going to be useful to you. So let me know. And we are also working on a guide where we're putting the contents of this presentation into a hopefully 2-pager so that you have it all at your fingertips. But for now, know that this presentation and the information on it, the slides are already on group site. The recording will be available soon. And I see someone saying like sometimes you call eligibility, you're directed to CSU, CSU sends you back to eligibility, and that is frustrating. And I think your rocks also want to hear about the specific situations that led to that too, so we can start to break down those loops and keep them from happening in the future. I know that's not a super satisfying answer, but the best way for us to tackle these things is if we know what's going on. So don't be shy in reaching out to your regional outreach coordinator. I think with that, I'm going to end our recording and maybe hang out for 1 minute longer just in case there's anything else that comes up. But thank you all for coming today. I hope this was useful. I know it brought up a lot of questions, and I think as you maybe start to put this into operation, you'll have more questions for us, and that's what we're here for.